So every formula has its own focus. So if we study a formula, it is very important to know what is special about this formula. So the topic of Ruta 4 is the constitutional treatment of oligo or amenorrhea due to phlegm and damp. And the purpose or the goal of Ruta 4 is to transform phlegm and damp, to move uterus qi, to tonify spleen qi, to move liver qi and drain liver damp heat. So all actions that we need to treat PCOS due to uterus stagnant qi with phlegm and damp. And each formula has its own character. So what is special about Ruta 4 is that it is very effective for regulating the menstrual cycle. It treats PCOS due to uterus stagnant qi with phlegm and damp. And it can treat damp and phlegm also in other organs, like, for example, the lungs and the channels. We can find gynecological symptoms, but also other symptoms here. So we have oligo and amenorrhea with catarrhal conditions and obesity. We have lethargy, sensations of heaviness and mental dullness. And we have heat sensations, or can have heat sensations, or mixed heat or cold sensations. The tongue is usually pale or red, maybe slightly purple, depends on the stagnation, and maybe there are also tooth marks. The coating can be thick white or yellowish and greasy. The pulse is slippery, especially at the spleen position and at the third position. And it can be vary, again, depending on the stagnation. As we want to treat PCOS here, we need to have a closer look to other symptoms concerning the menstrual cycle. So the menstruation itself is often scanty or too little. There may be even amenorrhea. Concerning ovulation, there is no or little egg white-like cervical mucus, although secretion of mucous membranes can be sometimes increased. And sometimes there's too little egg white-like mucus around ovulation, as cervical glands are blocked by damp and phlegm. The vaginal discharge in the rest of the cycle can be thick, white, sticky, or can be also heavy. And if we look at the body basal temperature, there can be a reduced basic pattern. Usually in a normal BBT, there is a clear rise in temperature on the ovulation day. But here, the biphasic pattern is not clear, and we find a very little rise in temperature around ovulation. If a patient undergoes fertility treatment, we can see the following patterns in PCOS due to uterus stagnant qi with phlegm and damp. So they can have a history of infertility for more than a year, so they have been trying for a long time already. If they underwent already hormonal stimulation for IVF, there can be many follicles, or we can find even hyperstimulation. And after hormonal stimulation, there might be persistent weight gain, bloating, and abdominal distension. Ruth will tell you now which syndromes can be treated with this formula.
We put in bold the primary syndromes. These are uterus stagnant qi and damp and phlegm. The others are secondary syndromes: spleen deficient qi, spleen stagnant qi, liver stagnant qi, and liver damp heat. Lung phlegm is in italic because it can be there, but it is not mandatory. If we have a look to the gynecological symptoms, uterus stagnant qi can be seen with amenorrhea, oligomenorrhea, infertility, PCOS, dysmenorrhea, premenstrual syndrome, and menstrual irregularities. Liver stagnancy can be seen with abdominal distension, intolerance to fatty food, menstrual irregularities, premenstrual syndrome with distension of the breasts, depression, moodiness, mood swings. The relevant symptoms of DAM and phlegm can be sensation of heaviness or sluggishness, amenorrhea, infertility, catarrhal states, obesity, mental dullness, lethargy, forgetfulness. If there is damp and phlegm, there is usually also stagnation. Here typically spleen stagnancy with signs of sensation of heaviness, fullness, discomfort in epigastrium and abdomen, fatigue, intestinal flatulence. And if there is stagnation, there is on the one side too much, DAM, phlegm, and on the other side too little. And we recognize spleen deficiency with signs of digestive weakness, lack of appetite, discomfort, distension in epigastrium and abdomen, exhaustion, worry, depression, sensation of dullness and heaviness. So we can see with the help of the 4 imbalances at a glance, we definitely need to move something. Uterus stagnancy, and if needed, also liver spleen stagnancy. We need to transform and drain phlegm and damp. With these 2 strategies, we can already achieve some improvement. Why is it not enough? We need to drain damp and phlegm, and on the same time, we need to prevent heat. We know from Chinese medicine that damp and phlegm can result in damp-phlegm heat. And we need to tonify spleen deficiency. This supports also the transformation of DAM and phlegm.